Hi guys, my name is Katie Holly, and this is my micronutrient presentation. Let me go ahead and get to my screen. All right, so once upon a time, if you got sick, your doctor might recommend that you spend some time out on the countryside or go to the beach or anywhere really where you could get some fresh air and some sunlight. And this might have sounded, to us like something kind of, you know, old and funny, but really they were onto something because there is something to be said for the sunshine aspect, and that is vitamin D. So the first question is, what is a vitamin? Vitamins are essential organic substances needed in small amounts in the diet. They're not a source of energy. Instead, they aid in energy metabolism as well as in the growth, development, and maintenance of body tissues. And the reason I bring this up is the question becomes, is vitamin D truly a vitamin? Because it doesn't necessarily hit all of these qualifications. Vitamin D is more correctly classified as a conditional vitamin or a prohormone. And the reason is that given adequate exposure to sunlight, our bodies can synthesize enough vitamin D to meet their needs. But it's that getting enough sunlight that becomes an issue. And in the past, we saw a lot of deficiencies due to that lack of adequate sunlight and not having from supplements, which we have now. Because it is classified as a vitamin, it's classified as a fat-soluble vitamin. And vitamin D from sun, food, and supplements is all biologically inert and must undergo two hydroxylations, the first in the liver and the second in the kidneys, in order to be activated and used. Because we consider it a vitamin, it does have an RDA and upper limits. And for infants and young babies, this RDA is around 10 micrograms. That's actually an adequate intake. And then for children from the ages of 1 up until adults 70 years old, that RDA becomes 15 micrograms with a tolerable upper intake between 63 and 100 micrograms. I said milligrams earlier, it's actually micrograms. And then for adults over the age of 70 years, the RDA is 20 micrograms with an upper level of 100 micrograms. Now, there's question whether or not the current RDAs reflect the actual needs for vitamin D, and these are more recent RDAs. They were changed just in the past few years. But the issue becomes that comparing our intake from food and supplements to our blood serum concentrations is problematic. And one reason is that the comparisons can only be made on group means rather than on data linked to individuals. And then another is the fact that the sun exposure affects vitamin D status. So we can't just look at, well, I'm taking in this much vitamin D, therefore I should have this much in my blood serum, because the sun is such an unquantifiable factor. Commonly recommended daily intakes of vitamin D are known to be insufficient if sunlight exposure is limited. And it's important to be aware that vitamin D levels are affected by both geographic and seasonal variability, and that a person with an optimal level in the summer may well become deficient in the winter without any change in diet, and as a result of the changes just in sun exposure. So RDAs for vitamin D represent a daily intake that's sufficient to maintain bone health and normal calcium metabolism in healthy people. But it actually doesn't take a lot of other potential things that our body uses vitamin D for into consideration. The major functions of vitamin D: it promotes calcium absorption in the gut. It maintains an adequate serum calcium and phosphate concentration, which enables normal mineralization of bone and prevents hypocalcemic tetany. Vitamin D prevents rickets in children and osteomalacia in adults. It works with calcium to protect older adults from osteoporosis. It helps in the modulation of cell growth, regulates immune function, regulates the secretion of several hormones, including insulin, renin, and parathyroid hormone. It plays a role in the reduction of inflammation, and it may reduce the risk of certain autoimmune diseases, infections, and cancers. We do have some food sources of vitamin D, but they're really not very good. The best food sources that we have are fatty fish like salmon and herring and mackerel. And then obviously also the cod liver oil. That's really the best source that we have, and the only really good food source, if you want to call it a food source. We can get it from canned tuna. There are foods that are fortified with vitamin D, such as dairy and orange juice. There's a small amount in eggs, Swiss cheese, and mushrooms. But if you go back to what the RDAs are, if you look at them in those international units, which I didn't initially, but the international units are around 1,000 international units a day. And you look even in our really good sources with the fish, you're only getting about 1/5 of that. So food is a really bad source of vitamin D. We do have deficiency diseases. We don't see the true deficiency diseases as much as we used to. The two big deficiency diseases that we talk about with vitamin D are rickets in small children, and that's where the bones aren't mineralized enough from the very beginning, and you see this bowing that occurs. Then there's osteomalacia in adults, and this is where our bones are not a static thing. They're constantly being broken down and demineralized. And if you don't have enough vitamin D in the body, then you're not going to have enough calcium circulating to mineralize those bones. Calcium actually is pulled out of the bones and into the blood circulation. And so because of that, you see where the bones become more porous, they bow, they crack, and they're just in general softer. Factors that affect vitamin D absorption. Exposure to sunlight is a very big one. And this can be affected by the latitude that you live at. The closer you are to the equator, the more sun exposure you're going to get. Season, if it's the summer or the fall, you'll have more exposure to sunlight than in the spring or the winter. Time of day, obviously. Clothing, something that I hadn't thought about. Women who wear like burqas aren't going to be getting adequate exposure to the sun. And then sunscreen, it only takes an SPF of 8 to block vitamin D synthesis in the skin. We also have issues with malabsorption syndromes since vitamin D is absorbed in the intestines. So conditions like irritable bowel disease, celiac disease, chronic diarrhea, these are all going to cause problems with vitamin D absorption. Gender, we know that absorption is lower in females. Skin pigmentation, the more melanin the skin has, the greater the reduction in vitamin D synthesis that's going to happen. And then something I found was interesting is obesity actually is a factor in vitamin D absorption, since vitamin D is a fat-soluble vitamin. Having excess adipose tissue can sequester that vitamin D and alter its release into circulation. Then there's also a factor that comes along with age or lack of mobility. We generally talk about this in regards to people in nursing homes, but you can't discount the effect of things like video games on young children and keeping them from going outside and playing. Diet can also be a factor. Many physicians and patients think that adequate vitamin D intake can be obtained via the diet alone, but this assumption is erroneous. With the exception of fatty fish, the vitamin D content of most foods, including fortified dairy products, is relatively low to non-existent. Some physicians may be uncomfortable recommending larger doses of vitamin D supplementation, but that fear is generally unmerited given the dearth of reports of vitamin D toxicity compared with the expansive literature on vitamin D deficiency. So we really don't see a lot of toxicity. We do see a lot of maybe not traditional deficiency in the sense of malacia, but there's a lot of insufficiency, and we're going to talk about that in a bit. But toxicity causes overabsorption of calcium and hypercalcemia, which leads to deposits of calcium in the kidneys, heart, and lungs. You have issues with anorexia, nausea and vomiting, bone demineralization, kidney dysfunction, but all of this can be turned around relatively easily just by withdrawing vitamin D supplementation in the early stages. If the supplementation persists beyond the early stages, however, toxicity can eventually be fatal. Toxicity is always the result of excessive supplementation. We don't get vitamin D toxicity from sun exposure because vitamin D is broken down very readily in the skin. And and we don't get it from food because intake of the food is so minimal. Some researchers estimate that the body requires approximately 75 to 100 micrograms to maintain optimal blood levels, and that's what we see with the current upper limits. But the clinical data provides evidence that vitamin D is not toxic at much higher intake than what is currently reflected in the upper limits. So even going up to that upper limit should not cause a problem. Functions and metabolism, honestly, as far as energy metabolism goes, vitamin D doesn't play much of a role, regardless of whether it's synthesized in the skin or consumed in food or supplements. All of the sources of vitamin D ultimately function as a hormone. I apologize for the clicking. My dog just walked in. The most interesting thing to me goes back to what I talked about with there are issues with insufficiency as opposed to, actual deficiency, and vitamin D through insufficiency can play a role in diabetes and also in colon cancer. We know that high levels of vitamin D deficiency are seen in recent onset patients with diabetes, and that studies have shown that D3 supplementation causes an improvement in HbA1c levels, regardless of whether they're looking at control groups that have poor control, fair, or good control. It helps all of them. And then the effect of vitamin D on glycemic control had no difference based on age or sex. As far as cancer goes, research has shown that the incidence and death rates for certain cancers are lower in southern latitudes where the exposure to sunlight is higher. And they've shown that the higher intake or blood level of vitamin D are associated with a reduced risk of colorectal cancer. And research is being done to try to determine a dose to associate with that risk reduction. As far as a media highlight goes, I just went straight to Google, typed in vitamin D, and then hit the news button. And what came up was in the past week, a study was published regarding vitamin D and schizophrenia. And said previous research has identified an increased risk of schizophrenia related to winter spring season of birth, living in high latitude settings, early life urban residents, and migrant status, especially dark skinned migrants moving to high latitude countries. And these are all things that we see with vitamin D deficiency also. So this Danish study confirmed that neonatal vitamin D deficiency was associated with a significantly increased risk of schizophrenia, and that those with a 25 OHD or below 20.04 nanomoles per liter, which is consistent with the standard definition of vitamin D deficiency, had a 44% increased risk of schizophrenia compared to those in the reference category. And that the developing fetus is totally reliant on vitamin D. So these findings would support the idea that maternal vitamin D deficiency is a risk factor for schizophrenia in the offspring. And so they now plan on doing greater research to try and come up with how the vitamin D supplementation could be approached in regards not only to the risk of schizophrenia, but also in looking at autism. My conclusion, essentially, vitamin D is tricky. It's almost impossible to accurately predict a person's intake and synthesis of vitamin D. And so the only way that we can look at vitamin D status is through doing blood tests. And so if you have any kind of question as to whether or not you're at a higher risk for any of these insufficiencies or deficiencies, I would recommend getting a blood test and actually seeing where you stand. The current RDAs for vitamin D are only aimed at maintaining proper bone health, not at any of these other things like diabetes, colorectal cancer, mental health. And so it's worth looking at those RDAs, reevaluating them, and understanding that our actual needs for vitamin D could be different from what the RDA currently suggests, but that there's enough evidence that the upper limits are very safe to suggest that we can supplement above the RDA and feel fairly confident in doing so. And then finally, here is my works cited, and I thank you all for listening.